All right, good morning, everyone. Thank you so much for being here at a very early hour on a Friday morning, but particularly as students who do not have to get up this early on a Friday, but those of you that are here, you get many extra points for being here. So, good morning, everyone. I'm Fiona Wilson, and I have the honor of being UNH's Chief Sustainability Officer and Executive Director of our Sustainability Institute here. I'm really thrilled to welcome you to this event, Human Health, Planetary Health, and What Sustains Us, as part of the Sidore series. We're really delighted to be collaborating and co-hosting this event alongside our colleagues at UNH's College of Health and Human Services, UNH Health and Wellness, and UNH's Center for the Humanities. I think it's really appropriate that we're here today talking about these topics. There are world leaders from all sectors gathered in New York this week. That's me. How bad is that? Thanks, Beth. My lovely husband. There are world leaders from all sectors, nonprofit, government, business, gathered in New York this week for New York Climate Week. But I have a little secret. I think the cool and really interesting people on this topic are right here in Durham, New Hampshire. So thank you for being here. I imagine that you, like us, are here today because you understand the enormous challenges that we face as a human race, from the climate crisis, growing income disparities, food insecurity, global political instability, public health crises, and many other issues. We understand that these challenges are inextricably linked and interconnected. And because they're so complex and interconnected, they really call for integrated solutions. And this sort of interconnectivity is really at the core of sustainability, which we define here at UNH as the collective commitment to human dignity for all people and ecological integrity in all places. And as we discuss these challenges today, our aim is really to be collectively and creatively thinking about how do we really cultivate a community committed to supporting health, well-being, and sustainability for everyone, because that is really critical to our human and planetary survival. And we'll think together about some of these perspectives, practices, and tools that we think are needed at this pivotal moment in time. And indeed, it is a pivotal moment in our history. There was a report that was released this week by the Potsdam Institute for Climate Impact Research that has warned that humanity is pushing beyond the limits of a stable, resilient, and healthy planet. And they highlight how the economic risks, right, are really spiraling as planetary health declines. There are 9 indicators of planetary health. You're probably going to hear more about that from Semra. But 7 of those 9 planetary boundaries for planetary health have already been breached. So pivotal moment indeed. But today's agenda is really designed to help us think both at a global and a local scale. And we hope that those who are part of the UNH community will also join us in thinking about how these ideas on a global and national level can also really relate to some of our own practices here on campus. But before we get started, we wanted to share our deep gratitude to our collaborators for this event. And it's really my pleasure to introduce Dr. Megan Howie, who is the director of the Center for the Humanities and also a professor of anthropology and earth systems here at UNH. This event is made possible by funding by the Saul O. Sidore Memorial Lecture Series Fund, which Megan is going to share a little bit more about. So Megan, thanks so much.
Thanks, Fiona. As she said, I'm Megan Howie, director of the Center for the Humanities, which sponsors the Saul O. Sidore Memorial Lecture Series. So I just want to make sure to give you a little background on who Saul Sidore was, where this funding comes from, and welcome everyone here today. This series was established in 1965 in memory of Saul O. Sidore of Manchester, New Hampshire, a son of immigrants. Sidore found success in the knitting industry, building his company Pandora in Manchester, New Hampshire. He was passionate about ethical business practices and led by example, pioneering benefits for his employees, including profit sharing, pension plans, health insurance, which at the time was very rare, and college scholarships for their children. The purpose of this series, established in his memory and funded in part by an annual gift from the Saul Sidore Memorial Foundation, is to offer the university community and the state of New Hampshire programs that raise critical and sometimes controversial issues facing our society, which seems like something more pressing than ever to have a space to talk about those things, and that the Sidore family has really, really been behind that idea for a long time. Today's Sidore Symposium, organized collaboratively by UNH's Sustainability Institute and Health and Wellness, brings us together to learn and explore pressing questions about human health, planetary health, and what sustains us. And I should just say, we host an annual competition for Sidore series at the center, and we were thrilled when Fiona and her team brought this proposal forward. So it's really exciting to see it come to fruition. A dynamic set of speakers is before us will inspire and interrogate ideas about what it means to cultivate a community committed to supporting health, well-being, and sustainability for all. This is a timely topic in the world at large, as Fiona really just contextualized. And right here at UNH is one of the 4 strategic pillars of UNH 2030 is a commitment to well-being and belonging. So I think it's particularly great to be having this now, this semester, as we're about to launch that. Thinking about what we do now to repair our relationships with the earth, each other, and ourselves can feel wholly overwhelming. But it's through events like this where we can gather in place together to learn and engage in constructive dialogue that we may find something connective among our varied experiences. I really believe that. I'm an archaeologist, and I think I study the past because I believe those fragments give us those connective tissues to the past and the present, and moments like this are those kind of opportunities too. Thank you again to the organizers of the symposium for all their efforts, especially Fiona Wilson, Chief Sustainability Officer at UNH and Executive Director of the Sustainability Institute, and Elle Farrell. Where is she? Out in the hallway working, of course. Yeah, Associate Director of Culture and Operations at the Sustainability Institute, who from my perspective has done a lot of work for this, so I hope she knows that. All the work, I hope she knows. Okay, I'm like, Elle deserves a big round of applause. And Kathleen Grace Bishop, Director of Education and Promotion for UNH's Health and Wellness, and then whoever else in your staff helped that I don't know, but that's who we've interacted with at the center, and Katie, also the Assistant Director from the center. And to the speakers, thank you for joining us and sharing your time and expertise, and to everyone for coming together in the spirit of the Sidore series over the past 30 years, right, or more, to bring people together to engage critical issues facing our society. So thank you and welcome. Yeah.
All right, let's see if I can get the mic working. I don't know if folks can hear me okay? Yeah? Well, thank you all for being here, and thank you, Megan, so much for the opening. I am now going to start us off, first of all, with a little about me. Very briefly, I'm Semra Aitor. I'm a professor in the Department of Health Management and Policy here at UNH in the College of Health and Human Services. And I'm an epidemiologist by training, so all my life, I've been interested in the intersections of health and well-being with other ways in which we live on this planet and live in harmony with others. So I am really thrilled to talk about planetary health and to just give us some ideas about a framework that we can use to help us think about this concept. And I'm drawing from many interdisciplinary traditions, as I'll give you just some visuals and mental models to think about today. First, I'll sort of give you a classic definition of what planetary health is from the Rockefeller Commission, which sort of coined the phrase. So planetary health is defined as the health of human civilization and the natural systems on which it depends. That's probably one of the most widely known definitions if you were to Google this. But I think for me, what's even more inspiring is it is a solutions-oriented, transdisciplinary social movement focused on analyzing and addressing the impacts of human disruptions to the Earth's natural systems and ways to optimize health through reciprocity, our relationships to each other, and how we treat the planet, because the way we take care of the Earth enables the Earth to take care of us. So planetary health really focuses on this notion of interdependence and connection. It emphasizes balancing human needs with the preservation of the Earth's ecosystem services to sustain health and well-being, both now and for future generations. The other thing I love about the planetary health framework in my work as a public health practitioner and someone who practices epidemiology is the way in which, it was actually on the previous slide, but that's okay, it really unites other social movements that some of us have been part of or might identify with. And I'll just name a couple of them: the One Health movement, the eco-health movement, if you're coming from psychology or social work, environmental justice, which many of us are committed to, GeoHealth, which is global environmental and occupational health. So these are all movements in their own right, but they have found, I think, a common home under the umbrella of planetary health. The next thing I want to share with you on the slide you're seeing now is the Planetary Health Education Framework. And this is from a paper that was published in The Lancet in 2021 by Guzman and colleagues. And the reason I wanted to share this one, it's a little bit different from the planetary boundaries that Fiona mentioned and all of the different indicators. There are now many, many ways that we can measure different states of the Earth system. But this one focuses on education. And it kind of simplifies things based on 5 key domains that we believe comprise the essence of planetary health: knowledge, values, and practice. It also centers on nature connectivity. In the middle, you'll see that that interconnection with nature is at the center of these 5 foundational domains. And I really love that personally because I think nature is a place where many of us can find common ground. Many, many people, especially in our beautiful state of New Hampshire, do value a state of being able to access nature and find solace in nature to promote their own health and well-being. So putting nature at the core, I think, is really important. We also have a lot of unique programs here at UNH and at our partner institutions that promote enabling people, all people, to access nature in a positive and safe way. And that can take some intentionality and commitment. So that is what I love about it. And then on the other colored parts of this, I think there's some really important things just to mention. The nod to history that Megan mentioned, thinking about the Anthropocene and health. So our history, whether we think back to the Industrial Revolution or even before that, how have human relationships to the Earth changed? Movement building and systems change. It's really about us committing to collective action and breaking down silos. And then systems thinking and complexity. Anyone who teaches in pretty much any discipline is always thinking about how to enable both students and the people we work with in communities to connect the dots so we can find the holistic notion of health that I think is promoted here. And then again, a commitment to equity and social justice, which is central to so many of us. So that's a little bit about the Planetary Health Education Framework. And the next slide, if I could have one more, yes. So this one, a little bit of shameless self-promotion here. We are publishing a book on planetary health that is coming out in 2 days. This is a co-edited book with, thank you. Myself and 2 other colleagues edited a book, and what is really unique about it and who deserves the applause is it is written by, with, and for students from multiple disciplines. So those of us who wrote the various chapters, which include case studies and very practical, hands-on examples in the real world that are then married to the competencies of the Planetary Health Education Framework and a few other frameworks from public health, really are intended to showcase how people are working together, whether that's student-faculty collaborations, academic community partnerships, and all the other ways in which we are doing the work together that connects us. So the little phrase that I made we brainstormed on what to call this for a long time, is the CONNECT framework, which stands for Community Networks for Nature, Empowerment, connectivity, and transformation. So that's what CONNECT stands for. And just to point out a few parts of this, because I think it's important to acknowledge that all of this, if you start from left to right, really is predicated on people having access to positive nature experiences. And how we promote that is where the movement building comes in. The other thing that's important is in the middle, just like, again, building on the shoulders of giants, the nature connectedness piece is at the heart of this framework that myself and my colleagues worked on, and acknowledging that indigenous knowledge has been underpinning that for millennia. So this isn't something that we invented, it's rather something that we are trying to, I think, rekindle and feel again in our busy Western lives, but other cultures have been intrinsically nurturing this knowledge for millennia. The other thing that I wanted to acknowledge is in the circles, the reason there are circles is I think the places where we can intentionally bridge silos, just taking this one as an example, is there is a little bit of a disconnect, at least in my work as an epidemiologist, in terms of what people who are used to working in maybe the health and human services or the healing arts writ large, and people who do other equally compelling work, for example, in civil engineering, who actually build and shape our environment and can choose to do that in a number of different ways. And the practitioners who are focused on what are called nature-based solutions, green infrastructure, blue infrastructure, some of the terms you might hear now in the media, where we are trying to build things that can work a little bit more sustainably with the Earth's systems. But where there's an intersectionality, even right here on our campus, is the chance to bridge people who are doing therapeutic practice, whether they're coming from social work, psychology, doing outdoor therapy, which we have a huge center for outdoor and adventure therapy here at UNH, people who practice psychology, social work, etc., or simply are leading camps or being coaches to enable people in their communities to experience nature in a positive way. 4-H would be another great example that I benefited from when I was young. But again, thinking about how we can bring those practitioners, their students, the communities they serve together in that little intersection where I call it nature-connected solutions. And that's just one example of bridging silos so that people are amplifying their work and their impact. And I think when we do that, connecting to some of the work and the wonderful speakers at this room, our chance of collective action and the potential for advocacy, the potential for pro-environmental behavior, because once we realize that we have this identity, this connection to nature, the scholarship of some of the experts that we have speaking to us today, that enables this potential for collective action that then can conserve nature, promote biodiversity, and feed back into the positive nature access and experience that enables health. So that's just a little bit of a way to think about it. And then the last thing I wanted to show, just really briefly, is you can change slides to the next one, please. This one I won't go into as much detail about, but again, it's words that some of you might have heard about depending on which discipline you're coming from. So some of you might have been familiar with the term exposome, which is often used in toxicology, some of the medical, more toxicology-oriented sciences, genetics, epigenetics. And it is really the combination of thinking about how what we're learning about the human genome, which we now know quite a bit about and are still learning, is related to what we're learning about the environmental exposures, positive or negative, that turn our genes on or off. So there is a tremendous emerging science called exposomics, or the exposome, that is learning about these gene-environment interactions. And of course, the environment here, we're thinking about not just the traditional natural environment, although that's a huge piece of it, but the built environment, those planetary systems, the policies that support, or we want to support, environmental health, and that all of this is socially constructed. So at the bottom, we have political structures and processes. We are the agents of change. And that is, I think, something important to remember here. And the last thing I'll show, just again for my students, if any of my students are in the room, you can change slides to the next one, is the social ecological model, or what I call the onion, Some people find this the most intuitive visual because it thinks about our individual health, our personal genetics, our personal psychosocial makeup, and all of the layers of influence that surround us, which would be that exposome or that envirome. That's another word that's sometimes used. We are influenced by relationships, those interpersonal relationships. Our communities, our organizations, our institutions, that it is our civic ability to participate in and to help to shape. So conversations like this, I think, enable us to participate in those conversations. And then that in turn affects the largest layer, our larger political and social structures that trickle down to affect our individual and community health. So whichever visual you choose, whichever one you find helps you to think about these complex systems in more maybe simple ways, wrap your arms around it, keep those in mind, and we are going to just go on into the next set of the presentations now. I want to, before I introduce the facilitators, thank two people who are really, really special today, Beth Grosso and Michelle Holt-Shannon, who will be our facilitators. And they are both individuals who have been committed to authentic community engagement, equity, and belonging for so long. And I am just so grateful and want to offer my heartfelt thanks to Beth and Michelle. Beth is the training director at the Institute of Disability here at UNH, and Michelle Holt-Shannon is the director and co-founder of New Hampshire Listens. That's an organization that actually promotes these civic dialogues across the state. And both of them are just very, very skilled in facilitating critical dialogue. So I think we are going to bring Beth up first because Beth will be in charge of facilitating our panels. And I'd like to invite Beth and our panelists to the stage. Thank you so much.
Good morning. Thank you for that lovely introduction, Samra, and for such important background information as we head into this panel discussion this morning. It is my honor to welcome this morning's three panelists. Dr. Sue Ellen Brakey is director of the Center for Climate Change, Climate Justice, and Health, a distinguished teaching associate professor in the School of Nursing at MGH Institute of Health Professions, and a fellow in the American Academy of Nursing. Her clinical background includes cardiac surgery, critical care, hospice care, and global health nursing. For over 10 years, she was a leader with Team Heart, a nonprofit organization that provides RHD screening, cardiac surgical care, and follow-up, and patient-provider education in Rwanda. Her scholarship interests include the impact of climate change on human health and well-being, bioethics, and global health ethics. Dr. Brakey is a co-author of Global Nursing in the 21st Century, which was published in 2015. She co-chaired the National League for Nursing's 2022 Vision Statement on Climate Change and Health. Dr. Brakey has published widely and presented locally, regionally, nationally, and internationally. Welcome, Sue Ellen. Dr. Susan Clayton is the Whitmore Williams Professor at the College of Worcester in Ohio. Dr. Clayton's research examines people's relationship with the natural environment, how it is socially constructed, and how climate change affects mental health and well-being, with a particular focus on climate anxiety. She is author or editor of 6 books, including Identity in the Natural Environment, Conservation Psychology, and Psychology in Climate Change, and is currently the editor of the Cambridge Elements series in Applied Social Psychology. A fellow of the American Psychological Association and the International Association of Applied Psychology, she was a lead author on the 6th assessment report of the Intergovernmental Panel on Climate Change. Welcome, Susan. And finally, Stacia Clinton is the founder and principal at Collective Well, bringing experience as a health professional, executive leader, and movement designer to support individuals, groups, and organizations in building inner development skills that foster well-being while achieving mission. Stacia spent nearly 2 decades in leadership with the global nonprofit organization Healthcare Without Harm and US-based practice Green Health, leading transformative, systems-level initiatives at the intersection of human and environmental health for thousands of health systems worldwide. Currently, she is lead planner for Wellbeing for Impact, an initiative to create intentional spaces and opportunities that nurture well-being among change makers by cultivating essential inner development skills necessary for outer impact. She is a contributing author to the book Promoting Biodiversity in Food Systems, and her commentary featured in outlets such as National Public Radio, USA Today, The Washington Post, Time Magazine, and The Lancet. Welcome to our three esteemed panelists. So our first question for today is, as we think about our global world, what concerns you most about human and planetary health? And we're going to start with Stacia.
It's a tough one to start on, especially at these times. It feels a bit loaded, you know. I think that there are many things that are concerning, that are happening in our country, in our world. In doing this work for a number of decades, those concerning things have been happening. It's more prevalent now, it's in the media now, we are seeing it a lot more, we are talking about it a lot more. And certainly those are concerning. And I could go through sort of the nuts and bolts of different policies or setbacks that have been happening that are very concerning. But your question was, what concerns me most? And for me, what concerns me most is that we will get caught in a limited mindset. So our minds, when we are faced with complexity and uncertainty, and that can generate a sense of fear, and it can either cause us to shut down, to numb out, or to really double down on a perspective that we think is the right way and the only way. That can create more divisiveness and more limiting thought. There's some important research that I thought was incredibly valuable when thinking about how people are looking at the issue of climate change now. There was a study that was done a couple of years ago that looked at the 18 top interventions around climate change. And they surveyed people throughout the world, 23 different countries, looking at what did they think was most important in terms of the interventions. And it differed between different countries, but what was surprising to me is that overall, the one that rated the lowest out of the 18 was moving away from fossil fuels. And for anyone who knows a bit about sort of the drivers of climate change, fossil fuels have been found time and time again in science and research to be the fundamental driver of climate change. And what raised high on the list were things like additions. So they didn't want to take anything away or change the structural system, but rather maybe we could add clean energy or some tax credits or other things. And that follows with our mindset of gravitating more towards not sort of shaking up the norm, not shaking up something that's uncertain into looking into the future, but rather sort of adding a Band-Aid and so on. And so that concerns me, that that's where we will stay because of that fear and that the way that we process sort of uncertainty. And I also know that related to our mindsets is that some research was done that shows that the longer that we stay in a fight or flight or fawn, which sort of your sort of heightened sympathetic nervous system, sort of your panic, the longer we stay in that mode, the more prone we are to extremist views and to othering dynamics. And the less we are able to welcome a more collective approach. And so really, changing our mindsets and opening ourselves to the complexity, to really being able to sit with the complexity of the polycrises we're facing right now is paramount.
Thank you so much, Stacia. Polycrises. I think that's my new word, because it is. It's so complex, and as Semra said, it's all very much interrelated.
I'll just tell you, it's not my word, but you can take it.
I'm borrowing it. All right, Sue Ellen.
Okay. So I come from this, from my background, I'm a nurse, as you heard, and really I spent so much of my career in the hospital setting, in critical care. And so it's kind of interesting that I've shifted to more of a population health perspective. But so I'm really concerned about the way these climate hazards are impacting human health and well-being. And we're seeing it. I mean, I drove here today and I'm looking at the risk for wildfire signs that are up. You know, we're seeing this is impacting people, and I think it's really important for health providers and students and health professionals across the board, because it is a interprofessional and transdisciplinary problem, right? That we are aware of what our clients and our patients are facing. And so we have done a lot of education with clinicians, students, faculty, community members, and clinicians don't necessarily see this climate change as something that's central to and important to their work. But when we kind of identify the different health impacts that are related to extreme heat, air pollution, mental health impacts, the populations that are being impacted, older adults, children, pregnant people, people with disabilities, the chronic, people with chronic physical and mental illness, these people are all being impacted, and health providers like, wow, I didn't realize that. And so there's something we can do, and for me as a nurse, I think one thing we can do, in addition to helping people, making people aware of these impacts, and by the way, it can be done in a very apolitical way, right? We don't have to talk about climate change. We can talk about extreme heat, poor air quality, et cetera, you know, increases in vector-borne illness, waterborne illnesses. I think we have, one thing that we can do, for me, I consider it low-hanging fruit, is to just help people understand what their individual risk is. Because without that knowledge, they can't prevent or mitigate health harms. And so, you know, the work, we were talking beforehand, and we know so many people, and I know Rosemary, Karen, and I mean, the world is very small. The climate change world is small. And people are really invested in getting the word out and addressing this issue. And so, to kind of circle back, I'm really concerned about helping people understand their risk. And I'll tell you a really quick story if I can.
Oh, please do.
So I was actually in the midst of writing a chapter for a textbook around heat-related illness. This was July a few years back, and we were in the middle of a heat wave. My mother, who is still with us at the time, she's 93, but she must have been about 87, I'd say. So every day during this heat wave, I called her up, and I'd say, do you have the air conditioning on? Are you drinking your water? You know, I'd go through my little checklist. So it was a Saturday, called her up, it's about 11:30, hung up. A half an hour later, I get a phone call from the local community hospital. She had gone out after we hung up, got into a fender bender, so it was about noontime, ended up in the hospital, aphasic, which means, you know, when people are having a stroke, the words that come out don't make sense. Her temperature on the scene was 103.6. So when I got to the hospital, she was in the ER, and so she had symptoms of a stroke, right? And she had a fever. So basically what she got was what I call the $1 million workup. She was worked up for an infection. She was worked up for a stroke. She deteriorated neurologically and had to be transferred to another hospital by ambulance to the ICU. So all of the, and of course, I felt horrible because part of my checklist did not include, please don't go out during the hottest time of day. Like, don't go out between 10 and 4. Do your errands early or later. So it was so eye-opening for me because here I am, someone who's steeped in this issue, and my own mother, in front of my eyes, had a situation that resulted in a hospitalization. So, and by the way, three weeks later, it dawned on me that when she left the hospital, she didn't have any discharge teaching related to what she went into the hospital for, right? So no one did any kind of an assessment about what her future risk was around heat-related illness. So we have there's a huge gap in what we're doing in hospitals. I think it's getting better, and not just hospitals, but within the community. So I think my concern and my goal is really to increase awareness among students, faculty, providers, and community members so they can mitigate and prevent health issues related to climate change.
Thank you so much for sharing that story. Susan.
Yeah, thanks you. I hopefully pick up on both of these things, and I'm going to cheat a little when I talk about what concerns me both, because I'm going to say two things, and the first is, of course, climate change, and I may be telling some of you in the room things that you already know, but I really want to stress the health impacts of climate change, and not just on physical health, but on mental health. And we have, when I first started to look into this about 10 years ago, I was surprised by how much evidence we already had. And I think people don't, it's still a relatively new topic. People don't realize the evidence body that supports these impacts. So just to give you a categorization so that you have a framework for how these effects are working. We all know climate change is associated with more extreme weather events like major storms, wildfires, floods. Probably everybody has been close to one of these things. We have decades of research showing that mental health problems go up after such events. Not surprisingly, they're very stressful. So you see increases in PTSD, anxiety, depression, also interpersonal violence in response to those kinds of events. And more recently, research has started to show us neurological effects of experiencing those kinds of things. And of course, long-term effects on children, which we often don't think about. So that's the very obvious impacts of climate change. The chronic changes that we really need to worry about because they're affecting everybody and they're incremental, especially heat and lower air quality. Air pollution and more particulate matter, for example, that too has mental health impacts. And one of the things we've started to see just in the past maybe 4 or 5 years is lots of evidence linking high levels of heat to psychiatric events like inpatient admissions and suicide. Again, there's lots of reasons why heat might have an effect on the brain, and it does. One of the things that we know heat does is increase preterm births. Well, think about the impact of preterm births on long-term cognitive development and susceptibility to mental health problems. Those are both high. So I think we really need to be aware of the long-term impacts on children of living through these kinds of events. We also need to be really aware of, I'm sure we will be continuing to talk about social determinants of health as Semra kind of gave us the background for the indirect impacts associated with climate change. So lots of displacement, people who have to leave or involuntarily forced to relocate from their home grounds. That, of course, not only can be an event that leads people to grieve, but it also tends to tear you out of your social connections. And social connections are hugely important in protecting both physical and mental health. As probably many of you have heard, the impact of social connections is as strong as the impact of smoking. I think the figure is 15 cigarettes a day. So if you're torn loose from your social connections, you're much more vulnerable. Climate change also associated, of course, with economic impacts, with food insecurity, and increased inequity as those who have money and resources are able to recover from these kinds of events more easily than those who do not have that sort of financial cushion. And then the last category, which as a psychologist is really interesting to me, is this idea of how we think about climate change. There's a lot of anxiety associated with people's worry about the kind of world we're in and the kind of world we might be in 10 or 20 years. We were talking about this at dinner last night, especially the young people who are thinking things like, I don't know what things will be like in 20 years. How do I plan for my future? How do I decide what career to pursue? Should I have children? Should I be saving money? There was one study that asked people this, and about half of them were saying, yes, I should save money now because I'm really going to need it when those climate events start to hit. And half of people were saying, I should just spend it now because nobody can predict the future, the banks might collapse, so I might as well spend it. So a great deal of uncertainty, which is of course stressful, leading to climate anxiety, eco-anxiety. And this is not a mental health problem necessarily. It's a very rational response. But of course, high levels of anxiety are a source of stress that can, in some cases, lead to clinical issues of anxiety and depression that impair your ability to function. So that's my first concern. I want to just, have a little bit more time. My other concern is disinformation, mistrust, threats to science, and essentially the calling into question of objective reality that I think we're currently facing in society. And of course, that concerns me because how can we know anything if we don't do the research, if we're taking down websites that post the facts or we're failing to collect the information? But also because of even if the information is available, we don't necessarily trust it. The bonds that hold us together as a collective seem to be eroding. And again, one of the consequences could be called collective ignorance. And some of you who may have had psychology classes may remember learning about studies in which people were in a room and something vaguely disturbing happened, like they heard a crash or they started to see smoke come into the room. And the question, the big empirical question was, well, are they going to get up and do anything about it? And a lot of them didn't. They would sort of sit there and kind of look around and think what's going on, but they would just stay seated because they didn't know what to do. And they were more likely to stay seated if other people were with them. So if they were by themselves, if they were alone in a room and heard a crash, they tended to get up and go see what was happening. But if they were surrounded by other people, there'd be this kind of, well, is anybody else doing anything? No. So maybe everybody else knows what's happening and I'm the only one who doesn't, and I'll look like a fool if I get up and do something. And everybody in the room is thinking the same thing. So that's what we call collective ignorance. And I think that's the kind of world in which we're finding ourselves right now. And I can say a solution, or at least one solution, is to not allow ourselves to be shut down by the apparent ignorance of those around us, but to articulate our concerns. Because one of the things we know about climate change, for example, is that the majority of people around the world and in this country are concerned, are aware, and want government to do something about it. And this is true it's more true among Democrats than Republicans, but it's also true among Republicans that the majority are concerned. So I think overcoming that collective ignorance is a really important step forward.
Thank you very much. We're going to move into our second panelist question. And Susan, you ended the last question, and you're up first for the next, so a nice seamless transition here. What is it that each of you are working toward? Or in other words, what is the world that you want future generations to have? And what does the world you are working to create look like?
It's such a great, it feels like a Miss America question.
It really does. We should have sashes.
But I want world peace. I really want a world where there is greater human health and well-being. This is one of the goals of psychology as a field, so it's very compatible, it's very important to me. And I want to mention sort of an expanded understanding of that goal in two ways. And one, Simra very much set up for us already, which is thinking about, well, what do we mean when we talk about health? And the World Health Organization, which apparently I won't even say what I was going to say. But they define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which I love. It's an important reminder. Our goal is not just to not be sick. Our goal is to be well. And that well-being is not just physical, but it comprises our bodies, our minds, and our social interactions. So just reminding us that you can't really separate the physical and the mental. And, coming from sort of the mental health field, and especially the social relationship side of that, the idea that very many people tend to think mental health is not as important as physical health. Like you can kind of fix yourself when it comes to mental health. And just recognizing that you just can't separate mental health out from physical health. And they are both very much affected by social relationships. So what we want is a well-functioning physical body with manageable levels of stress, good cognitive, the ability to achieve our cognitive potential, good social connections, positive interpersonal relationships. All of that is part of well-being. So I want that, but I want people to recognize how that's connected to environmental issues. So again, the fundamental need to recognize our own, not just connection to, but interdependence with the natural world. We cannot be healthy in an unhealthy environment. It's obvious that, if you live next to a waste dump that's emitting toxic fumes, or if you're living in an area with high levels of air pollution, or even if you're in an environment that's physically unsafe, that's going to threaten your health. We need to recognize that some of these impacts of natural conditions are more subtle, but at least as important. And then more recently, and I think this is really important for us to remember, and also part of my aspirational goal, again, as Summer was talking about, recognizing the positive impacts of healthy nature on our health and well-being. And at a sort of anecdotal level, people have recognized this for a long time. You can read about connections to why people talk about gardening, and why we have places like Central Park and Boston Common, is that idea that public parks promote well-being. One of the most important studies in the psychological domain was done back in the 1980s by Roger Ulrich. Some of you may be familiar with this. He took advantage of a sort of natural experiment where people who had a particular surgery in a particular hospital were randomly assigned to different rooms, some of which had a view of the natural world and some of which had views of brick walls. And he found that the people who were in the rooms where they could see trees and foliage recovered faster from the surgery, required less pain medication. That was back in the 80s. There's been tons of research since then that has demonstrated the same thing, that being out in nature is good for us. It reduces stress, fosters positive social connections, perhaps cognitive activity, et cetera, to the extent that you now have some sort of medical professionals prescribing visits to nature as part of their wellness advice. So what I really hope for is a society in which we recognize those important connections between natural health and human health, and have the sort of infrastructure that can facilitate and promote those connections.
Thank you so much. Stacia, what's your vision?
Yeah. Well, it's interesting because we were listening to the opening remarks, and then I was talking with Sue Ellen, and there's a lot of synergy in sort of what I'm hoping for in a really embracing a holistic, transdisciplinary perspective on health. And just to share a bit about my background, I, started my career, I'm trained as a clinical nutrition professional. So I started in healthcare, but I gravitated towards that profession, not just because nutrition was a pathway to clinical health, but also because I saw the role that nutrition and food systems played in the health and sort of vitality and the well-being of my life. And I saw it in others, whether it's from traditional traditions that we had over food, or the cultural pieces that pass through different generations, or that very, sort of nurturing sense that you have when you want to provide food for others. I talk to farmers and food businesses. That's why they do the work they do. They want to provide for not only their family, but their communities. So when I pursued nutrition and I got into healthcare, I tried a lot of different orientations, from clinical care to administration, outpatient, inpatient, and I found a lot of frustration and limitations in the way that healthcare sort of broke down into silos. So I navigated over to working with Healthcare Without Harm, a nonprofit that was embracing that intersectional approach of looking at health alongside public health, and saying that when we really subscribe to do no harm, what does that mean for healthcare professionals in hospitals? What does that mean for our mission? And it means embracing a broader perspective on health that looks at what is making us unwell in the first place. And all that's been shared about climate change, indicates we need to be paying attention to climate change, to planetary health, to environmental health. We also need to take into account the many disciplines of healthcare. We also need to look at what people, individuals, and communities think drives their health and their well-being, and what that means to them, as I shared. There were certain things in my life and experiences. For instance, there was a very influential person in my life, my father, went through cardiovascular disease when I was a teenager. And I saw the role that food played in his health and well-being, and it motivated me to want to help others in that same way. So when we medicalize health or food, we lose the relationships, and our systems have sort of factored out the relational aspect of health. So the future that I see is one where relationships are placed at the center. We can talk about, and we have been talking about, climate change for decades, unfortunately. And we see progress and we see setbacks. And that's going to continue to happen as we cerebrally and intellectually talk about it. But the reality is, what we're facing is not only something we're facing in our minds intellectually, we're facing it in our bodies and in our hearts. The stress that we feel when we open up the news in the morning, or we see some discourse that is triggering for us internally. It doesn't only resonate with making sense in our minds intellectually, but it resonates with something intuitive, whether that is, as Susan was talking about, is sort of that interrelationship. We feel connected to each other and to nature. Something is in conflict there. And if we are only looking at solutions through our heads alone, then we are limiting ourselves to really finding solutions that embrace the wholeness of us as a humanity. So looking at embracing not only our thoughts and ideas, but our visceral experience. How do we address that? The somatic experience of being in the world today and where our hearts are. And if we put connection and relationship first in our conversations, in our discourse, in our response to things in the world, how would that change people's receptibility across political lines, across perspectives, to open up to solutions? And so the world that I want to see is one that taps into that intuitiveness, to that sense that we have as humans and individuals, to our individual stories about why food, clean air, safe water, connecting with our community members matters, and it's valued.
Thank you so much. I really appreciated what you said about listening to how people conceptualize their health, right? So we have a lot of expertise on this stage, right? But it starts with, how do our community members understand their health, right? And starting there. Thank you. Sue Ellen.
So I think, kind of building off what you just said, as an educator, when I went to nursing school, we didn't learn about the social determinants of health. We didn't learn about health equity. We didn't learn about structural violence. These were things that we didn't discuss. And I think where I guess the work that I am doing is to really help students, in particular, understand the communities that they serve. And we do that in different ways. We have a lot of community, we have a van, a mobile service van, and we have students go out into the communities that surround where my campus is, which is in Charlestown. So communities like Chelsea, Roxbury, and they get to actually see what's going on in those communities. They get to see that they're environmental justice communities. The impact of the Tobin Bridge, which is the largest bridge in Boston, the impact of Logan Airport. For those of you who aren't familiar, Chelsea is a very, very small city that's right outside of Boston. It sits right under the Tobin Bridge. It houses all the fuel for the region. It has the large salt mounds, and that salt is distributed, during the winter for roads. And so while it's a really small city, it had one of the highest mortality rates related to COVID because of all these environmental exposures. It has like the third leading hospitalization rate for kids with asthma. So it's really impacted by environmental exposures, which are then compounded by climate hazards. And so we've been really purposeful about getting students out into these communities so that they can understand, because I'll tell you, the students who come to our school, they want to work in critical care, they want to work in maternity, they want to work in pediatrics. You don't have a lot of students who come in and want to work out in the community. Hopefully that will shift and change, but that's typically the mindset people come in. And as I mentioned before, they still have to understand where these people are coming from so that their discharge teaching or the interventions that they propose are realistic. I'll tell another quick story, which is right during COVID, somehow I developed asthma and some allergies, and bad time to develop asthma and have a cough during COVID. But I went to the allergist, and I was having like really bad issues with my sinuses, and so they said, okay, we'll go out and buy these special sheets to put on your bed, which like prevent mites and that kind of thing. Well, guess how much those sheets cost? They were like $400, and it didn't work. So then they were like, oh, get an air purifier. And I said, okay. Guess how much the air purifier costs? Like $500. And so as I work with the students and we think about, okay, who's being impacted by, who's significantly being impacted by asthma, let's say. And it's oftentimes people who live in these environmental justice communities. So you can't say to someone who doesn't have a lot of money, go out and buy $400 sheets. It's just not going to work. And so helping students understand how to know their communities, how to interact with their communities, and also how to learn from these communities. Last year we went on some toxic walking tours with some community leaders. One was in Chinatown in Boston, one was in Roxbury. And we walked through Roxbury and we saw, the remnants of these historical injustices that had been done to that community. And it was really bad. And an example was even like today, the state has air quality monitors that they put up. And this environmental group that we were working with said, you know what? Where that monitor is located, it's not a realistic depiction of what the air quality looks like. And so they put an air quality monitor in a park. And they've been collecting data, and they've been able to make policy changes with the city of Boston based on the data that they're collecting. So it's really for the students and for me really to see how these grassroots efforts are making their communities healthier is just so important. And it's also important because as health providers, we need to, what we haven't been good at is engaging in policy and advocacy. And we need to really teach students how to do that because of the importance of health and how it's central to our well-being. And so when we have these experiences and when the students go out into these communities, we have them write reflections and they're getting it. They are getting how inextricably linked social determinants are with climate and with environmental health. And they're also understanding that they have a role to play in working with communities to advocate for better policies. And so my hope is that the health providers that we're graduating will not just be looking, at the patient that they see, but will be really understanding what those upstream factors are and working both to address issues that they see in individual patients, but also to really advocate for policies that will impact in a positive way population health, particularly for those environmental justice and climate justice communities.
Thank you so much. We're going to move to our final question. As we think about the urgency of the climate crisis and human and planetary health, what's one key takeaway from today that you want the audience to think about or do? And we're going to start. Sue Ellen, you're now the seamless transition, so you're up first.
So I think one key takeaway is that for me, this is such a crisis we're in, but at the same time, there's a lot of hope out there. I look at the younger generations, they know what's happening, they're angry about it, and they want to do something to address these issues. And not only the issue of climate change, but also the issue of health equity. And so I think it's important to have some nugget of hope and to thoughtfully think about all the good work that is happening. I spoke with Stacia earlier, and I was saying, and I mentioned we have all these people in common, and I've quoted you and referenced you in a lot of work. So it's the climate change space is fairly small, but there are people who are doing really good work, and the people who are doing it are just really, they're so invested in this work too. We have had we hosted a few national symposia over the years, and we've had people like Bill McKibben, Gina McCarthy, Carlos Guzman, Barbara Sattler. These people, you email and you say, would you like to speak at our symposium? They go, okay. And they do it gratis because people feel like the messages have to get out there. And so it's funny because Gina McCarthy spoke at our very first symposium, and for those of you who don't know her, she's from Dorchester. She's so smart, and she's done so much good work. She's got the thick Boston accent. And I said something to her I kind of said something to her about how sorry the state of affairs was. And she was like, you know what, you sound like my husband. And I tell him, shut off the news, just think about something positive. You can't wallow in this, go out and do something, go take a walk, but you can't always be feeling the weight of it. So I think that if there's one thing I would say, understand what your individual risks might be, learn about that. I think people, for the most part, do know their risks because you know what your environmental and climate hazards are, but just kind of continue to have some hope, and we really need that right now, particularly, just this very week, there was some really, bad news out there, so have hope.
Thank you so much. I often say, we can't get stuck admiring the problem, right? And so, we need to understand the problem in order to identify solutions, right? But make sure that you don't get stuck there. Right? So thank you for leaving us with that message of hope. Susan.
Yeah, well, I really want to support and underline that message of the importance of hope. And I heard a scholar once describe hope not as, we think hope is an evaluation, like I'm hopeful because the evidence supports it. And she said, no, hope is a deliberate act. You decide to hope. It's almost a strategic, a political decision. So I think we need to be hopeful. My key takeaway, if I were to give one, would be to embrace those two positions that, none of us can do everything, all of us can do something. There are things we can do. I really liked, Stacia was bringing up the example of food. A lot of people don't recognize the impact of food on climate change, not just your choices about what to eat, but just food waste. This to me is such a thing because nobody loses if you stop wasting food. And apparently 40% of our food is wasted at some point between the production and the consumption of food. And it goes into landfill, so you can see how it contributes to environmental damage. So food is an issue that's really close to home for a lot of people. It's very personal. Food really fundamentally embodies our interdependence with the natural world, and it's very core to our identities. So that might be something that you could choose to take action on, but that's just one example. I want to briefly say that, when it comes to, well, how do we do something? How do we not give up? To think about where you are in that kind of decision process. And a couple of people developed this, what they call the stages of change model, describing if you want to make a behavior change, where are you? There's pre-contemplation, when you're kind of vaguely aware that a change might be needed, but you're not really thinking about it. Contemplation, when you are thinking, do I need to change my behavior in this regard? Do I need to, drive less? Do I need to eat less meat? Those kinds of things. But it doesn't have to just be individual behavior. Then you need to prepare to make the change. Then you need to actually make the change. Then you need to maintain the change. And then you need to give yourself a little bit of grace if you relapse. And this applies equally to something like, am I going to go to the gym 3 times a week? Am I going to quit smoking? Those kinds of things. So just recognizing what stage you're at and what tools you might need at that stage. Do you need more information? Do you need more social support? Do you need to restructure your own environment to make the changes easier, to eliminate barriers and so on? So just thinking about our own, the takeaway message is that we do have, it's so easy to feel powerless, and I think this is one of the things I hear people talk about the most, their own set of powerlessness. We all do have some power, as there are many quotes out there. We can't choose the situations and the conditions we face, but we can choose how we react to them. So to sort of recognize your own agency and think about the best way to use that.
Thank you so much. Hope is a verb, right? Thank you. Stacia.
Yeah, I mean, just thinking first on this concept of hope, I think doing climate change work and being steeped in it is both challenging, but also can give you tremendous hope. Just to share some of the work that we've been in over the last decades, 20 years ago, we launched something called the Healthcare Climate Challenge for hospitals and healthcare facilities globally to recognize their need to embrace, a broader perspective of health and to address climate change. And that has reached 500 institutions representing 32,000 hospitals and healthcare facilities globally in 53 countries. Continues to grow, despite changing administrations or political discourse, continues to grow. When, politics have changed and different governments came into play and we stepped out of the Paris Accord, businesses, industries, hospitals, schools joined together in something called We Are Still In to continue to commit to climate change, to take action, to move forward. Health professionals are getting it, as Sue Ellen had mentioned. We just put out a curriculum where a fellowship where health professionals can apply to be advocates and leaders in the global space around climate change. There's 35 spots. 2,000 health professionals applied in the first round. So there is a movement happening that is based in something independent of political discourse, what we hear in the news and the media, and that gives me hope. But it was interesting, someone had asked me sort of how you've done this work in the global sphere, which I have been steeped in for a while. How do we bring it down to what can we actually do? What do I want to tell you to take away? And actually, after those years of doing that work, if I could go back 20 years ago, I would change how I showed up in that work. I wish I had showed up more grounded. I wish I had recognized how things were affecting me and was able to sit with that discomfort and listen better. And now, as I move forward into my advocacy, I'm doing it different. It's not about being right. What it is about, first and foremost, is building relationship and connection and trust, because movements are built on relationship, connection, and trust. And you may not change someone's mind, but maybe in that process of building that relationship, they have released a bit of the intensity on their opposition to create space and openness for maybe not your way, maybe not their way, but maybe a new way that pulls everybody together. And so I think as we move forward, one of the most powerful things that each of you can do is to bring your whole selves into it in a new way, recognizing your heart, your mind, your body, and our interrelationship with each other. Bring that into the work that you do in the advocacy and in every conversation that you have around climate change.
Thank you so much. Can we have a round of applause for these amazing panelists? I'm now going to invite our facilitator, Michelle, who is going to give us instructions for our table talk exercise here.
I'll use this one. Hey, everybody. Thank you. You're giving us a lot to think about. What we want to do next is give everybody a chance to have a little conversation at your tables, and then we're going to, my colleague Michaela Townsend and I, we're going to run the mics and have you have a chance to interact and ask questions of our panelists. And so the questions that we'll ask you to talk about with each other, they're pretty open-ended. We know you'll talk about whatever you want to talk about anyway, which is good. But just what stood out to you, what are you sitting with in the conversation, and just thinking about some of the values and commitments that you have related to planetary health. And if you have questions for our panelists. And please take your time with introductions. We want to give you a chance to kind of meet some other folks that are in the room. On your tables are our group agreements. And I thought there was a slide for them, so I didn't bring them up. But they're all right in front of you. And just a way for us to just remember that, we don't all agree on all the pieces. And thank you, Simran. Give each other space to have the conversation, being curious and open to learning, showing respect and being authentic and welcoming that from others. So the other thing, which is a little annoying, but I'm going to invite you to, if you're at a table of just one or two people, I want to invite you to scrunch down and join a table of three or more, and be in a group of about 5 or so would be a great number, given the group in the room. You have about 20 minutes, maybe a little more, for the conversation, and then we'll run mics and have a large group conversation again. Okay, thank you. All right. I'm going to invite our panelists to hop back up on the stage. So, giving you a chance to wrap up that, hey, Grace, that thought. Michaela Townsend has a mic over there, and I have one right here. And really, we just want to have a little exchange. So if anyone has a comment or a question, or just a topic that caught energy at your table, raise your hand. We'll run right over to you.
I'll just share quickly that, I mean, we talked about lots of things, but I think we spent a long time talking about the issue of human connection and taking it out of the cognitive to the heart and to the connections, and how there's simulations that you can use to help people understand true impacts to health and environment. There's sharing stories that connect with people's hearts and people they love. And so we're kind of contemplating that. How can we do more of that? How can we share information in a way that people see that it impacts all of us, everyone? And so all of us need to come together, take it away from that divide. The divide is convenient because dividing us allows for things to continue as they are. But if we can connect with the heart and connect with the personal, and that all of us are being impacted. So that's, I think, where our conversation kind of set. Do you want to say anything about the simulation?
I have just a question for the panelists, I guess. So I work in the K-12 space, especially with high schoolers that are soon to graduate. And there is just this very daunting, not having control, things happening that I just don't have a lot of agency over. My question is, what advice would you give, or what are your ideas around providing agency in a world that kind of feels very daunting right now, so that they leave? Like, there are more kids leaving without a plan from high school. If you ask them, hey, what's your plan? Any plan. I really don't have a plan. What are you excited about? And they're like, I'm really not sure. What are you anxious about? And they have a laundry list of things they're most anxious about. And so, I'm sure when we graduated high school, it was pretty awesome just to graduate. Not anymore. That there are kids that are really not that hopeful about their future. And I guess my question is, we're talking at a university level, we're talking about adults, but what about kids? We have this generation. What are your ideas or thoughts on that?
I can start. I'm interested in your thoughts. So what I this is my perspective, that when you ask the students, what is your future, what are you interested in, and there's nothing, there's a sensory overload that we're all experiencing. And there's research that's done on, we have tools to sort of take back our attention that's been hijacked by media, by social media, and so on. And it's a very old tradition of mindfulness. Yeah. Yep. It's so, and this is not extracting mindfulness from the deep cultural heritage that it has and has been applied in a more westernized model, but it's really going back to the roots of how mindfulness is practiced. What does it mean? What does it look like? And learning from that, because it is a tool. And they've actually done studies in a report that I think they might share in your follow-up information called Reconnection, Addressing the Climate Crisis from the Inside Out, where those who have practiced mindfulness were like, even they did politicians, and they said, I feel like I can now disagree better after practicing mindfulness, and that people's attention and ability to retain knowledge was increased as a result of practicing mindfulness. So that's another way that gets out of your head and into your body. And so it's a practice that can be integrated into high school and so on, so that you take back your attention.
Yeah, I love that. I want to pick up, sort of tie what you said back to that idea of sharing stories a little bit. And one of the things I think people, especially young people, need is this validation. Like, you're not wrong. We understand where you're coming from. You know, let's maybe have an opportunity for people to talk to each other about their own personal experiences, their own stories that are leading them to this place. And then at a very concrete, basic level, give them a space to do it. You know, give them a room, give them a time slot, give them, what they need to have this opportunity to talk to each other about it. Provide examples. It's so easy. I mean, and I say this like it's easy, it's not, but here are examples of people your age who actually made a difference. Hopefully not overwhelming ones, like we can't all be Greta Thunberg and so on. But here's somebody local who did this thing, and maybe opportunities. Like, if you learn that you can have an impact, that can be so powerful. So maybe look at something in the school. What can we change about the school? Are they not recycling enough? You know, should we provide more composting? Can we plant a garden in the backyard? Can we reduce our energy use for lighting or whatever, make it more energy efficient? So opportunities to, at a very small local level, actually have an impact. Maybe a newsletter to inform their fellow students. I think that can be such a powerful learning opportunity that hopefully will help them retain and enhance that sense of agency and efficacy.
I had one more thought, but you could go ahead.
Well, I just was going to say that I provided a keynote address to the New England School Nurses Association, and they're seeing what you're describing, and it's exactly what you said, that they these nurses and the teachers that they work with are doing things like engaging students in building a garden, or the newsletter, or exactly what you said, just picking something small that doesn't seem overwhelming, that just does give people agency. And and if you're doing something positive, you have less time to be thinking about the negative in some ways. So.
Yeah, just one last thing I would say is, agency is one of the primary indicators of well-being, people having agency. And when the world feels like out of control and you can't control it, you always have agency over how you respond and yourself. But that requires a set of skills that needs to be developed. And just wanted to share another resource in that when we look at organizations and systems change, the Sustainable Development Goals have been our model for making progress. And a group of researchers from many different disciplines came together and said, we're not making progress on those goals. And they're positing that part of that is because the change makers do not have the skills that are needed to make those changes. And so out of that stemmed, based upon research, the inner development goals. Yes, exactly. And that is a framework that helps us to think about, can we help instill those skills in children so that they can feel the agency? And it's a set of 23 goals. I call them skills, but they're 23, and they're in 5 different pillars. And they're things like inner compass, self-awareness, presence, connection, appreciation. These are things that if we cultivate, we then feel more agency over our own place in the world.
That's great. Yeah, Simra.
Thanks. Thank you. So I just wanted to comment on a couple of things that you mentioned. The first one is for mindfulness. Many of us, this is more for the UNH campus, but it could be applied in high school too, are doing small mindfulness experiences without even a lot of really in-depth, we're not claiming that we're trained practitioners in Buddhism or anything like that, but just like taking people for a walk in College Woods and really just spending part of a class period where students, A, know that College Woods is here, B, that you can go there, and how can we just listen and tune in a little bit to nature or whatever you want to bring their attention to. So I've been doing that in my classes. I know a lot of faculty members are picking up facets of that. And in high school, I know, I'll just share one story. So my nephew is a high school student in Los Angeles and was really experiencing everything you talked about, supposed to go to college, doesn't know where he wants to go, what he wants to do. Just if you asked him, he couldn't really tell you. And he ended up just on his own going to a homeless shelter and talking to unhoused people about the issues they were facing with not having access to clean water, not having a place to take a shower during how hot it is in Los Angeles. And what he found was he was really good at talking to people that most people either are afraid to talk to or the people won't talk to them. And he was a little bit of a tech geek, so he learned how to use AI to sometimes reach out and have many people talking at the same time, and then they could review what they were hearing. So my point is, it wasn't that he was doing something that we would think of maybe as a tangible, product of something, but he learned how good he was at listening and at having people trust him. And that just taught me so much. So I just wanted to share that.
Anyone over there have a comment
Yeah, thank you so much. We talked a lot about, I come at these topics so academically. It was really nice to hear about practitioners and practice on the ground in the real world. I have a question about the mental health piece, which we were really intrigued by, but I do a lot of work with indigenous communities and in New England, and we've talked a lot about how winter to them was a place, not it was a home, and losing winter then is like losing home. And I wonder, with you talking about mental health and all of the things and social determinants, about losing seasons, what that means in a physical and mental health way, because that's losing our place, right in the world. So I don't know if you've seen any of that, but.
I'll just start off the conversation because we haven't talked about that yet today. The idea of grief. We've talked about, anxiety, worry, stress, but I think, and especially Indigenous peoples who tend to have these very strong connections to place and to the natural environment, and in many ways their culture is threatened by changes to the environment. So I just think allowing people. We talked, I think, a little bit about the importance of naming your emotions, to recognize the grief they're feeling and talk about it, and think about the parallels, between other kinds of grief we recognize, losing people we love, and losing places that are important to us, and maybe using some of those tools and just allowing people to acknowledge their own grief and not feel like, I can't attend to this. This is not relevant when people around the world are dying. No, grief for place is real and should be acknowledged. And maybe, you have to allow yourself to relearn what is it going to be like to live when this thing I loved is changed or gone. And maybe little rituals to acknowledge what you've lost can be important. Opportunities for the community to come together to talk about what this place meant. Those kinds of things.
Well, I'll share. There was this wonderful author when I was doing some work up in Canada, Native Canadian, who wrote a book called The Right to be Cold. And it was about her Native community and how the cold really, was part of their whole culture, the salmon harvesting and all of that. And it really speaks to her ability to articulate the grief that she was feeling. And I will say that my first inclination was, we have to stop this. We have to make this different. And I still wanted to go in that direction, but I also challenge us to accept the reality so that we can then solve for what's next. And that means grief and loss and changing of place has been part of our existence for the history of time. And so if we acknowledge and accept, accepting is not saying not doing anything. It's the first step in actually effective action. So to actually embrace what is the reality, can we feel the grief? What is that experience, and what is beyond it?
And I was just going to add, there's actually a word for what we're talking about, and it's solastalgia, which is like the solace of losing something that belongs to you. And when I look at the news and I just see all these, like these fires, and think about these people, they're losing everything. I mean, and then there are the, indigenous communities that are losing their homes and having to, be forced out of the land that they love. It's just incredible. And the other thing I'm going to add here is, so I'm actually on a little work group, and one of the people on the group is an indigenous man, and we were talking about, we're writing like a thing around an educational, it's like an educational report, but AI, as you mentioned, that's having a huge impact on natural resources, and particularly in areas, there's an environmental inequity issue there as well, because the people who are losing the resources are those people, like people who live on indigenous lands, etc. So I just, I think just to underscore, the mental health impacts are so huge and often invisible, right? We don't know, and I think, I just am so sad when I look at the news and you see all these people that are losing everything, in addition to perhaps losing family members and loved ones, but everything that belongs to them, that is their identity. It's just incredible. But I think the good news is there's more awareness that this is a really important issue that has to be addressed, coming more to the forefront.
Yeah, and actually, if I could say a couple more things. One of the things that has come up a little bit, but not fully, is the need to be strategic in conversations if we're going to have any impact on policy. And so what wording do you use, and what sort of themes do you bring up? And everybody can, I think, resonate to the loss of place. I mean, grizzled old farmers in the Midwest really understand the grief that comes with, losing your farm, watching this place change. So that can be an effective kind of communication strategy. But I also wanted to say about sort of indigenous peoples that, of course, they have a long history of displacement in many cases. So there can be that sort of collective trauma aspect to seeing more change, but also they have often some skills at learning to adapt and sort of recognizing those changes. And so that can be maybe a way of for other communities to learn from them, like, what do you suggest, but also for them to have that opportunity to recognize that their own history may enable them to deal with this a little bit better, and so feel a little bit more efficacy because of that.
Other
questions or topics?
If I could just say one more thing about that. So I did a series of patient and family education at Mass General, and out of that we got invited to speak at an art gallery in Stowe, Vermont, and they had an installation, and it was, I'm not going to get this completely right, but it was called When the Well is Dry, and it's from a quote, "When the well is dry, we know the worth of water." I might have that a little bit wrong, but it was all about this issue of loss, and there were paintings and there were photographs, and there was a photograph of a man from Puerto Rico, and the story was that the photographer was his daughter, and after Hurricane Maria, things were so bad over there that he committed suicide because of the loss. And so that's just one example, but it was a really beautiful art exhibit, and kind of taking another look at it. I always have a health lens on, but this was really it really demonstrated in a visual way the pain that people can feel.
Sorry, microphones make me really uncomfortable. So I wanted to go back to, I'm really glad that you mentioned AI, and I wanted to kind of go back to this idea of agency, especially with young people, because I think what I'm finding is that tech and AI is really removing some of that sense of agency for a lot of us. But the difference is that a lot of young people are recognizing it. Like you can't even do a search without, like we haven't been given a choice whether we want to partake in AI or not. And if you're a part of the UNH community, for example, you're not necessarily being given a choice in that regard either. AI is sort of, there's a lot of pressure around bringing AI into the academic world. So I just wonder what your thoughts are in that regard, in the sense of like agency and big tech, and thinking about like who owns these, who owns tech, who owns AI.
Yeah, I mean, I can start. So I am, I'm not an early adopter of AI. Let me just say that. And I just went to a conference, it was a big education conference, and it was all about AI. And you know, the message was, you know, it's here to stay, and you kind of need to learn to adapt to it because it's not going away. It's not really what I wanted to hear, but I was like, okay. But I guess, you know, and there's that piece that it's not good for the environment, but then there's a piece that, well, maybe it can be used to help solve some of these problems. But I think it's here to stay. And after going to that conference, I was like, okay, I'm going to have to embrace this because I don't want to be left behind, I guess. But I agree completely that, you know, you put in something in Google and AI pops up, and it's just, you know, we've talked a lot about it in our academic institution as well, because I think it's just going to move us away from connection, and I think it's going to change the way people think, and it's going to rewire our brains, and I don't know.
Yeah, I mean, just to say, this is a partially formed concept in my mind as well, because it's so emerging. The dialogue and conversations around this is really unfolding by the minute. I also believe that AI is inevitable. It is the way we're moving in terms of even geopolitical dynamics and so on. There's a really interesting dialogue around this sort of dystopia that will emerge, and then what's beyond that is a new way of relating in society that accepts, again, this reality of the tech sort of aspect, and then, again, returning underneath it to the interrelationship, because AI has taken out our need to work, a million hours a day and do all that, because they're doing a lot of short-circuiting things. I mean, really challenging, spins your mind to think about it. For me, I think I also I'm the last one to get a new cell phone. I just don't like having to do the new tech thing. But, I think if we can instill in people the value of a critical mind, this is the same thing we're wrestling with social media, that there's still the need to look at everything with your own inner compass and critique about, is this telling me what I want? Where is this information coming from? All of that is a way to continue to give ourselves agency, because we are populating it. We are populating AI. We are the lifeblood that is building AI. And so similarly, what we put into conversations affects what comes out. What we put into AI affects what comes out. And so we are in that phase of building it. And I think if you went back before the 40s and talked to people about how they felt about the Industrial Revolution, probably would have had some same fear and panic. And there was a lot that we could learn from what we should have done more cautiously during the Industrial Revolution that we could apply now. I have a hope that somebody's thinking about that. I know we're sort of racing to get it out there, and it's sort of our tendency. But I think it's a really critical conversation to have with young people today about what can we learn from these phases of evolution in our society that we could do differently now, and how can you have some agency amidst it? And it really is about having a critical mind.
Yeah, and I'll just completely agree that that it's here. It's here. I don't think we can turn back the clock there, and that really acknowledge that it's part of the feelings of uncertainty that people have about the future. How is this going to change our lives? I certainly don't know, and I think even the people who think about it a lot don't have a very good sense at this point. So we kind of have to just see what happens. But there are two things that we can do that might help. One is, I think it just emphasizes the importance of getting outside, detaching, putting down your phone, going for a walk, reminding yourself that you do have other senses than your eyes, and that you do have connections to other things, other people besides your phone. And also, one way to feel a little bit more in control is to enhance your understanding and to get that cognitive control. So reminding people, I think people have this, a lot of people, probably myself included, have a very vague sense of what AI does. And it's like, I've been reading in the New York Times, people are turning to AI as like, are you God? And asking it to, for sort of divine advice, or they're thinking about AI as, sources of parasocial relationships. But, what is AI? What is it doing? Where does it come from? Just reminding people of some of that core. Here is what it can do. Here is what it can't do. Here is the sources of information it's pulling on. That can be a little bit useful, I think.
I could be racing Michaela right now, but.
You were closer. Thank you. So Alexis and I just kind of bonded over this conversation about AI, and I shared this at dinner last night. I have a 21-year-old son who I had no idea of the environmental impacts that were happening right now. Probably some of the most blatant examples of environmental racism that we could see with our own eyes right now related to AI. And I felt terrible. And I had my 21-year-old school me on this because I use ChatGPT, and he said, I will never do it. And I was like, oh, that's ridiculous, whatever. And he's like, so I grew up in Memphis, Tennessee, and I had no idea that an entire neighborhood in Memphis, Tennessee has been decimated by the current storage of AI data and what that has done. And this was like just a couple of weeks ago. And I have promised him as a young person that I will learn and be educated and read. But it makes me think about, we are having these daily conversations about integrating AI when people are literally dying from the storage capacity that's required to put into ChatGPT the most simple questions. And it's happening so rapidly, and there's more discussion about how AI might lead to suicide than there is about the livelihoods and communities that people are living in. And the big storage facilities are being placed in the most vulnerable communities in our country and probably in other countries. So I've been schooled by my very idealistic 21-year-old, and I want to school us all because some of you knew all of this, and others of us feel pretty educated in understanding what's happening in our planet, that are not as schooled and knowledgeable. So I don't know if you want to say anything. I think you're like, I'm done.
I'll just share that, yes, and I don't think that's an AI issue alone. The issue is, do you use plastic? Do you ride a car? Fossil fuel plants and industries have been placed disproportionately in communities of color and lower income communities for decades upon decades, and that environmental injustice of the placement of those facilities is the issue, that we're continuing it. And so we don't want to, to me, yes, AI is now the culprit and a big culprit, but so is the hydrofracking and the plastics and the fossil fuels. And what sits underneath that is the ability to not pay attention to some over others, that othering dynamic that we talked about. And and I was mentioning some of the science that talks about the longer we stay in that fight or flight and fight sort of arena, the more prone we are to othering dynamics. And so if we are to address how we if we apply health at the center of business decision-making, if we were to embrace that, our decisions about where we place things, what the impact is, what the healthcare costs might be, all of those pieces would be considered. It is a systemic issue, and AI is jumping on the bandwagon.
Thank you. We have one more comment, and then we will.
So to follow up on the AI discussion, the one piece of that is not just the location, it's the incredible need for electricity, which is going to drive the fossil fuel issue, particularly with policy. So we need policy development that lets people realize that there's an economic component to this in addition. So to meet the electrical demands of the future of AI is going to mean more fossil fuels under our current policies and going to create more planetary deficits. So it's just something else to consider with the problem with AI.
Thank you. And I have one more comment out here. I was given the guilty look, like, come on.
Thank you. So this conversation is unbelievable, and I sit here, as many of us do, sort of welling up with how do we move forward. So thank you very much for all your comments and all of this. But I sit there looking through the filter of we just crossed another planetary boundary, right? We went through the 7th of the 9 planetary boundaries just this week. And Johan Rockström was saying, we've done that. We haven't bent the curve successfully yet. But there's still time. And of course, they were saying this about 10 years ago, really looking at bending the curve. And so the question becomes, what does it take, which is what we're all kind of talking about here. And I was thinking also of years ago, I don't know, maybe over a decade ago, a book called Blessed Unrest, talking about all the pockets of things that are kind of popping up all over the planet, right? You have people working on water, people working on social justice, people working on climate. And I'm trying to remember the author's name right now, but anyway, he was saying it's the largest social movement in the history of our planet, but it's in these different pockets. But yet, right, we aren't making that kind of come together to be stopping what we need to. So it seems to me that this communication, that this messaging is really the most important topic, right? We need data. We have plenty of data. We know what all this is. This communication that we need to be having makes me wonder, is there a central movement like Joanna Macy's Active Hope, right? We recognize the reality of where we are, but then we work together in a very wonderful way towards that. And yes, that may then get attacked because we're in a very big power dynamic at the moment, right, worldwide. But I was also heartened by looking at something where they're talking about in the EU, businesses starting to shift language. ESG was attacked, and now they're talking about resilience, and they're talking about other kinds of terms, and the work continues. So I guess, and by the way, with AI, just to pull that into the discussion as well, there are people concerned about the algorithms that are feeding AI and the assumptions, right? Assumptions of inevitable violence, right, or domination, versus possibilities of partnership and interdependence, deep ecology, which is the reality of the world that we live in, right? So I guess it feels to me like we need to have a common thread, even if I'm over here doing this and you're over there doing that we understand that we're all working together for this. And it seems as if there's power in numbers. And I'm just wondering if any of you, as a last comment, would have a comment about a sort of unified, emerging movement that people could relate to and understand that it benefits all of us.
Well, I don't have one. I think, a sociologist or a political scientist might have a better comment on how you create that sort of global movement. I do think that sort of two things in response to what you said that can be my closing comments. One is we have to remember it's never too late to make change. No matter how many thresholds we cross, it is always worth making change. So this is something to resist that sense of, oh, well, we're doomed now, no point bothering anymore. And I think the one thing that I think your comment reflects and that I think is informing perhaps all of these movements is we need to recognize interdependence. We need to recognize systems. There are so many people, especially in the US, where I think it's part of our culture. I think what I do, I have my rights, and they don't recognize how their rights infringe on other people or should be constrained by the systems and communities that they are in, whether that be how you're affecting other people, how you're affecting the planet, how you're affecting policy. So I think hopefully we can get a little bit smarter about recognizing some of those connections.
So I think for me, what would come to mind first for me would be Johanna Macy's amazing work on the work that reconnects. If people don't know about that, it is phenomenal. It operates on connecting with other people, disengaged from, not disengaged, but rather in parallel with sort of the chaos and panic and so on, but really on a really relational level. And I believe that there's power in that. But the thing that I think would be really important in the communication of the work that we're doing is what we are seeing right now is massive amounts of infighting amidst the masses. And we're fighting with each other, even in the climate community. You should focus on this versus this, or it becomes, Democrats versus Republicans, or it becomes different geopolitical spaces, what the issue is, what we should focus on. And all of that noise is distracting us from the primary drivers that are propelling climate change, which is the industries that have insurmountable power, that are making the decisions, and they're connected to politics and so on. So if we were to look at the pesticides industry, is connected to the pharmaceutical industry, is connected to the fossil fuel industry, and so on. And those industries are making decisions while we're all fighting. And so if we were to stop fighting with each other and turn our attention to these industries or institutions that are driving the realities that we're seeing today, how powerful we could be together. Saying we don't have to agree exactly, but we do agree that this systemic issue is where we need to put our energy, not with each other. And those industries are benefiting from our infighting. So, and the narrative about let's not fight you and me, let's look towards the foundation of our problems together.
Great, thank you. I'm going to ask Fiona to come back up and lead us next. Thank you.
Great.
Thanks for y'all's engagement. I appreciate it.
Yeah. Yeah. What an incredible morning. We've talked about a lot of heavy things, but we've also talked a lot about hope and the path forward. And I've been furiously making notes. I've been thinking a lot about this discussion and, what are the implications for a university like UNH? How should we be thinking about changing our curriculum in our College of Health and Human Services, in our business school, in our general education? UNH is going through a process right now of redesigning our general education. I wish the committee that was working on that could have been here today. But what really gives me hope, I think, is amazing leaders and experts like the three of you, Susan, Sue Ellen, Stacia. The work that you are all leading is incredible and meaningful, and is those currents that is going to create impact, I think, over the long term. So I really want to thank them again. So please join me in just saying a huge thank you to our incredible speakers. I want to say huge thanks as well to my colleagues Beth and Michelle for just facilitating and creating a great space for dialogue today. So Beth and Michelle, thank you so much. I wanted to say just a huge thank you for you all to be here, for choosing to be here today, on a Friday morning, to come and bring your whole selves and engage in such a really meaningful and rich dialogue this morning. But I also want to thank the people who made today possible. So there, you will see up there on the screen, you already heard from Professor Aitor a little bit earlier. So Samra, thank you so much for really setting the framework for today and for all your work on the planning committee. But you can see there's a long list of people here. Our colleagues Kathleen Grace Bishop from Health and Wellness, Paul Bonzani from the College of Health and Human Services, Beth Grasso, who I've already mentioned, Kerry Milaro, also a professor over in CHHS, and Erin Sharp, the Associate Dean at CHHS as well. But most importantly, I really want to thank my colleague Elle Farrell. Is Elle even in the room? She's outside. Somebody go grab her. So Elle has really been the lead. Elle, we're just talking about you. She's not so well today, so she's staying a little bit distant. But Elle has really been the lead organizer of this event since the inception, when it was just a little kernel of an idea. And we have a number of our colleagues from the UNH Sustainability Institute here helping out with logistics as well. But Elle has been the beating heart of this event and has seen it through a couple of evolutions. But thank you, Elle, so much for making today possible. Before we break for sort of a lunch break, I just wanted to talk a little bit about sort of, and this afternoon's panel, we have some of our speakers already here. So we're going to be taking sort of this kind of really amazing global perspective this afternoon down more to the sort of regional level. But I want to just sort of talk a little bit about, for a minute about sort of UNH and sort of how we're thinking about some of these things. I took the speakers out for a photograph. There's a little balcony out here, and it happens to overlook the ravine and College Brook. And it gave me an opportunity to talk to them. Semra already mentioned College Woods, but we have just finished the design of a new master plan for UNH. And many universities, when they do master plans, the flagship project is a $300 million, building designed by some famous architect, and those are beautiful too, right? But universities don't need more space right now. We actually need less space because of changing demographics. And our campus architect, our campus steward, Ken Weston, is an incredible architect who comes at his work through a lens of sustainability and health and well-being. And so the defining kind of central project of the UNH master plan is a $15 million project, which sounds like a lot of money, and it is, but compared to like new buildings that cost hundreds of millions of dollars, it's a very modest amount of money. And it's going to be taking College Brook out here, which has been sort of neglected and buried and hidden for decades. And it's going to restore the ecosystems around College Brook. And it's going to daylight by doing some selective pruning and other things. It's going to create much more daylight there. And then we're going to put in walkways and bridges and outdoor classrooms. And this incredible ecosystem is going to be sort of the defining feature that really unites our campus and gives incredible space for those mental health breaks we all need, but also for research and teaching and learning. So I think that's just one example of some of the things that we're doing. Hope we can do here. So if anyone knows a great donor who wants to give $15 million, we would love to hear from them. But I also want to, before we break for lunch, I want to bring up my colleague, Kathleen Grace Bishop. Kathleen is UNH's Director of Health and Wellness Education and Promotion. She's a co-organizer of this event, has played a critical role in designing the program. But would love just to bring her up, and just as we sort of bridge between this morning's kind of global perspective and kind of this afternoon's more local perspective, just to say a little bit more about work at UNH around health and wellness.
Hi, everyone. Thank you, Fiona. I just want to say the panel and the panelists and the discussion that has been happening this morning has resonated for me personally in terms of my personal life and the work I do here on campus in so many strong and powerful ways. So I want to thank you all and thank all of you for participating because of that. I do want to take a couple minutes to talk about sort of connecting again to what we're doing here at UNH. And you mentioned the master plan, which I had the opportunity to meet with the Ken and the consulting group. And I remember at the end, they just said, stop talking. because I'm like couldn't stop talking about health and well-being and all the different ways our campuses can make that happen, and was so awed by the priorities within the plan that we have now created that I hope will be a reality. So nice connecting. But I am here from Health and Wellness and representing us and the work we do. And we have actually had a relationship with the Sustainability Institute since it was the Sustainability Office in the 90s. And I remember when they first started, our office, Health and Wellness and Sustainability, got together just to talk about wellness and the connection there. And so it's so wonderful to see our ongoing connection in so many ways. Health and Wellness, of course, is the organization here on campus that works with helping students get well, stay well, and be well. Resonates from the conversation this morning. And we're not just about sort of we're committed to their health and well-being, their academic success, their professional development, and we know that work that we do is about grounded in self-awareness as well as skill building for them when we're talking about their development and growth. And so we do it in a variety of ways through the various works that our office does, whether that's our primary care or whether our health promotion or our leading public places as part of that. And I want to show the well-being wheel. And if you want one, we have brought some over as stickers. Students love them, and I love when I see them all over campus in various ways. And what I love about this wheel that we have developed and the institution has embraced is that it really talks about wellness as this individual pursuit and the complexity of who we are as humans and all that goes into it, and the fact that all wellness is not equitable. So again, connecting it to this morning in so many ways and the work to be done, but also the hands, which is well-being, which really speaks to the fact that none of us can be well unless the systems, the people, the relationships, the processes, the policies, and et cetera, support our well-being. And so there's a lot of work to be done, and that's why, in addition to our work that we do with students, we are very committed to changing the culture at UNH with so many people here on campus. And I do want to highlight that one of the pieces that the university is doing is that a couple years ago, we became one of the U.S. health promoting campuses in the United States. When we joined, I think we became like the 99th, and now there's close to 300 of us, which is kind of amazing. But this network is guided by the Okanagan Charter, which is an international charter that was established for health promoting institutes, which calls on colleges and universities to embed health and well-being into all aspects of campus culture. So research and academics and the environment that's either built or natural or social, and then to lead health promotion, action, and collaboration locally and globally. And so that's very exciting. And this charter really is supposed to provide principles and vision and language that has this piece for well-being for a person, place, and planet. And I think that's a really important component about that. So I am pleased that I get to co-chair the University Health and Wellbeing Committee with Paul, who's here and was a member of the planning committee, to do some work here on campus in this area for not just here at Durham, but all of our campuses, which is great. And then, as Megan mentioned this morning, the UNH strategic plan, which has this commitment to well-being and belonging, which I also have the honor to be one of the co-chairs of that subcommittee. And I'm very excited because what comes from that will really continue to move this work forward as we continue to. So I'm very excited about that. And thanks for giving some time for us as we transition into this afternoon, thinking about more local and regional aspects, taking it from the global. So work on all areas. So thank you.